Hi, this is Joe Kometz. I'm a doctor of chiropractic. Today I'm going to explain the X-ray marking system we use in the office. What you're looking at here is a 14 by 36 film. On the left side you have the A to P view, and on the right side you have the lateral view. When we look at the spinograph, we always look at it from the front view, from the back to the front, as if the spine were closer to us. And we start down here all the way in the pelvis to the obturators. Those two bones with the holes in them are the ones that you actually sit on, all the way to the iliac crest, which is the top of the pelvis, all the way up through the lumbar spine into the thoracics, and all the way to the base of the skull, the occiput. So the first thing we're going to do is number the bones of the spine. This is the atlas, and this is the axis. 3, 4, 5, 6, 7, 1. Then we're going to continue in the thoracics. This is 1, 2, 3, 4, 5, 6, 7. Here's 8, 9, 10, 11, 12, 1, 2, 3, 4, 5. 5 lumbar vertebrae. And there's 12 thoracic vertebrae there. And you have 1 through 7 up there in the cervicals. So what I'm going to do now is I'm going to draw the lines on the pelvis. I'm going to first start by dotting the area so it makes it a little bit easier for me to draw the lines. Put a dot here at the top of the iliac crest. A dot at the top of the transverse process body junction right here. You could also use the pedicles here at the bottom of the pedicles here. We're going to dot the sacral groove. We're going to use S1 right here, put a dot there. The lateral border of the sacrum, which is right here. We're going to put a dot on the top of the femur head. I'm going to dot the center of the pubic symphysis. This one's a little bit malformed there. And then we're going to also dot the bottom of the iliac crest here. And now we're going to start drawing some lines. The first line we're going to draw is the femur head line. This is really the baseline of the spine right here. And from that, we're going to roll up to the top of the iliac crest and draw a line parallel to the femur head line. Do that on both sides. Now we're going to turn that around and draw another parallel line on the ischial tuberosities here. These are the bones you sit on. Okay. Then we're going to draw a line here at the sacrum. Off the sacrum, we're going to draw, to get a measurement on which way that sacrum is misaligned, if at all, perpendicular to the line at the sacrum there. And we're also going to now take a perpendicular line from the femur head line, and we're going to cross there near the pubic symphysis to see if there's any rotation in that pelvis. Also draw a line here at the 5th lumbar to see if there's any wedging in that. From this view we can now get some measurements and see how the pelvis is misaligned. We're going to start with this left iliac crest right here, and I get a measurement of, these are going to be rough because the marker is a little bit thick, but let's just say that's 230. I'm going to do it over here too, and we get a number of 225. We're going to measure this deviation here, which is going to tell us the rotation. I think about 3 millimeters right here. Then we're going to also measure the rotation of the sacrum to see which side is shifted posteriorly, backwards. This one right here is 66. This one right here is 64. And there's a slight wedging here at the fifth lumbar, a little bit wider on this side than it is this side. So what we're looking at here is just the misalignments in the pelvis. This does not necessarily mean there's a problem here. This is just how the body is aligning itself to deal with its current condition. What this means, these numbers, they generally should be relatively the same. What that means when a number is bigger is that bone has actually moved backwards, and it's giving the appearance of it actually looking longer. And what this means right here is the pelvis has rotated this way. Okay? So there's a little bit of misalignment, and this also right here at the sacrum, you can see there's a differing number here. The bigger number would mean that sacrum has moved backwards, giving an appearance of a longer sacrum on that side. Other thing we look in here is any wedging of the fifth lumbar. Now, another thing you can do to determine how else is misaligned, you can see there's slight misalignment just by the holes of the obturator. You can see this one's a little bit more narrower and longer here. So what we're going to mark now is the base of the dens, which is right here, C2 spinous process. And what we're going to do is we're going to draw some lines here now. Start off at that mastoid process. Here's a line for the atlas. And the C2 body. Let's see if we get that. It's tougher to see on this. It's right about there. So we're going to start to see wedging over here. You can see it's a little bit wider on this side. Saying that would be a right atlas on that. Now it's important not to get too hung up in long line drawing and start to nitpick about some of these marks. They're millimeters off. That's not necessarily the way the misalignment, if anything, will be very, very visible on something. And the other thing is we're not adjusting from the x-ray. The best use of x-rays is just to see if there's any areas of congenital anomalies that we need to know about or any contraindications in there. And finally, what we use for comparative spinograms is we want to see how the baseline of how the body's actually sitting up here and adjusting itself here to this position. So what I'm going to do is I'm going to measure from the side of the film here, right at the S1, and I'll come up here and do the exact same thing, and then we're just going to draw a line way up. And you can see my client is carrying himself a little bit to the right. This is the left side, this is the heart right here, this is the right over here. And this is the number we're just looking at for comparison purposes. And he's carrying himself 12 millimeters to the right. Now once again, it's nothing to get so frightened over, it's just the way his body is bearing his weight. Because of the pressure in his spine, it carries himself a little bit to the right to keep the pressure off the spine. One thing we need to remember is the body is always adjusting itself properly for its environment. And when you have pressure on that nerve, right there, the body will bend, twist, and contort itself and put it into a position like this. Now, the most important view we ever use in chiropractic is the lateral view. The lateral view helps us see just how those holes are closing down and causing pressure on those nerves. Now remember, this is not what we're using to adjust the body. We're not basing the adjustment off this picture, but it can help us see and maybe even confirm some of the things that we see with the instrument reading, okay? So once again, we're going to start off at the top and we're just going to number here. 1, 2, 3, 4, 5, C6, C7. 1, 2, 3, 4, 5, 6, 7. T8, 9, 10, 11, 12. And here's the lumbar vertebrae, L1, L2, L3, L4, and L5. So the reason why the lateral is so valuable and very important is because what we're looking for is the closing down of these holes. That black hole right there is where the nerve exits. So anything, if that bone moves backwards, it's going to create pressure on the nerve. Just like in this model right here, as that bone moves backwards, it creates pressure on this nerve. So what we're going to do is we're going to start doing some line drawing to see where that bone has moved backwards. And these lines that I'm using were used by Dr. Goal. He's the one that set up this X-ray marking system. And his stuff is all available on his website, goalchiropractic.com. That's where I learned all this line drawing from. So what we're going to do is we're going to start at the fifth lumbar and see where there's some posteriority here. And right at the fifth, this is the back of the sacrum. It comes down this way here. So right here is the back of the sacrum. That's the back of the fifth lumbar. We're going to put a line on the front and the back of the fifth lumbar, a line on the back and the front of sacrum, back and front of fifth lumbar. Looks like there's some posteriority here at L4 that's moved this bone backwards, that's closing down on a hole. So we're also going to put a dot there on the superior posterior border of L5 right there, and then in the front of L5, back of L4 and the front of L4 there. I'm going to draw some lines. I'm going to see exactly how that's misaligning there. So right here, this is where the sacrum is right here. I put a line back there too, and a line up there. We're going to move up just a little bit. We're going to draw a parallel line back here. This line, we're going to follow the bone itself. Do that there. So what I'm going to do now is I'm going to see just how far posterior that bone has moved. And we're going to do that by using the sacrum as the base. And we're drawing a perpendicular line from this bone right here, the sacrum. Okay. And we're going to come back and we're going to measure this angle here in just a moment. But what we're looking for, and this is a little bit messed up here, so I'm going to measure from down here, is how far that bone has moved backwards. And this is the line that gives us that measurement. So we're going to say right here, this has probably moved back 3 to 4 millimeters, and I can't tell based on with the big marker here, but that's moved backwards 3 to 4 millimeters, so that's making that hole smaller. We're going to do exactly the same thing here at L4. Now once again, this is not used to determine what bone to adjust, it's just showing us how the body's aligning itself. Again, sorry for this mess. All these videos are available on Dr. Goal's website, but this is just an example here for you. I'm going to check this angle here. And this bone has moved backwards, probably about 3 millimeters on this one. Okay. It's a little bit of posteriority at L3 too, but we're not going to measure that right now. We're going to go up to the top of the neck. So first we want to start off at the occiput. What we're going to do for that is we're going to follow this down right here. Here's the sella turcica right here. So we're going to follow that all the way down, that ends right there, and put a line on the back of the occiput. This one actually you can see very well, the foramen magnum, which is actually almost the perfect line. It's not in Gonset chapter, but this would make the most sense back here. This is the foramen magnum right here. You can see that very faintly on that. And what we're going to do is we're going to come down and we're going to draw lines to the rest of the cervicals. So I'm going to draw this line right here. And you want to draw these lines pretty long. That'll give you an idea of how that bone is wedging. If you draw it really short and it's not so dramatic, you might not see any wedging with it. Right here we're just coming down to the base, so C2, and we're going to roll up just an inch or so just to stay off the disc, or just a few millimeters to stay off the disc. We'll do the same thing here with C3, 4, C5, C6, C7, and we're not going to be able to see T1 here. Now, once again, we're not using this to adjust off of. This doesn't determine anything for us. All that's determined by the instrument reading that we're getting on the delta T. But what this does is help us to determine if there's any misalignments in that area we're finding it. What we'll be looking for is posterior segments. Now, the reason these are vertebrae, generally they should come back together. They should all kind of converge. All these lines should be converging in the back here. And what happens is when there is pressure here, the body starts to once again, it'll bend, twist, turn, misalign itself in response to this pressure just to keep as much pressure off the system as it can. And sometimes it'll create this military-looking neck or reverse curve in the neck. So once again, what we're looking for is just to see how the hips have and the pelvis has aligned itself right here. A little bit of misalignment in the pelvis, nothing too much to worry about. We see a little bit of a wedge there at L5, and L4 also would be even more. I just didn't draw that line in. As we go up the spinal cord, you can see it's relatively in the center the whole way. There's nothing too much going on this spine that's interesting. And then of course when we get up to the upper cervicals here, what we're looking at is just to see how the atlas and the occiput and C2 are misaligning. Once again, it doesn't mean there can't be any other misalignments in this entire body. That's just where we're seeing it on a picture. And those are the lines that we're drawing in. So once again, on the side view, now we're looking at the fifth lumbar in this case. We're measuring the posteriority, how far that segment has moved backwards and closed down those black holes, because those black holes are where the nerve's at. Once again, this is not where we adjust. This is just showing how the body is aligning itself based on the nerve pressure that's already in there. Remember, the body's always going to do everything it can to keep those holes open as much as it can to get pressure off the nerve itself. Your body is constantly adjusting itself to every activity that you do in a day, every chemical that's ingested in your body, and every emotional or mental type thought that's coming in the body. Body has to constantly react millions and millions of times each minute. So as we're going up here, you can see we're looking at that fourth and fifth lumbar there and that wedging. Once again, that number right there is showing that the vertebrae, this is not anything for diagnostic or anything purposes like that. This is for pre and posts. On the post x-ray, we would expect to see some type of change in that area there, and it wouldn't be that the tip of the L1 would not be 19 millimeters anterior. Most likely it would change at that point. Up here in the thoracic, same thing. And then when we get to the neck, we're going to also expect to see a little bit of change in that curve as the body starts to realign and adjust itself. The final thing is, with the full spine spinographs, you can mechanically analyze these. You can mechanically analyze every vertebrae in the entire column, every curve. For us, it's not necessary. The reason why the bones misalign in the first place is when there's pressure on that spine, anywhere on those nerves, what that does is cause the body to try to keep pressure off those nerves, and it'll bend and twist and turn itself. Anything it could do to keep those nerves open, because these are the nerves that give you life. They're the ones that bring life energy to the heart, to the lungs, to the kidneys, to the prostates, everywhere in the body. So it's going to do anything it can to protect itself by bending and twisting and turning. So the best value chiropractically for these pictures is to really see the before and after pictures, just to see how the body's responded to adjusting. Remember, chiropractors aren't making the change, the body's making itself. Once this pressure gets off the nerves, the body will begin to realign itself in a more normal position for that body. And these things take time. On a final note, we can certainly force curves into the neck, into the low back, to straighten the spine. But that's not the goal of chiropractic. The goal of when there is pressure on that nerve, the body will bend, twist, and contort itself. So if you have not corrected the subluxation, if you go to straighten the neck, so if you're doing stretching or exercises at home, it's never going to stick because there's still pressure on the nerve, and it's going to go right back so the body can get in its best position for survival with that pressure. All we're looking for in chiropractic is a subluxation. Finding the subluxation, correcting it. Once the pressure is off the nerves, the body can realign itself to a more normal position for that body. Chiropractic is as simple as that.